Hi guys, I'm Andrea Leifer. I'm a physical therapist in New York City. I specialize in treating individuals with swelling disorders, primarily lymphedema, but I also work with patients with edema or swelling after orthopedic issues like a total knee replacement, sports-related injuries, just about any reason you could have swelling. I saw there was some question about compression socks and stockings the other day, so I wanted to hop in here and talk with you guys about them more. A lot of you, I think, have been getting compression socks on Amazon. That's where I order some of my own compression socks that I use when I'm traveling. But there are also other brands of compression socks that you may or may not be able to find on Amazon. Usually you can get through a surgical supply store. And there are different types, so I wanted to just show you some samples, talk about why one might be better than another for you, so you have some different options when you're considering compression to help with swelling after your knee replacement. So, first kind is just a knee-high sock. These can be open toe or closed toe, pretty soft, stretchy. This would be if you're noticing foot or ankle swelling or even calf swelling after your knee replacement, but not a lot of knee swelling itself because it ends right below your knee. It may create more swelling at the knee if that's an issue you're having. So that would be one reason you might want to avoid a knee-high sock, as if it's making your knee swelling worse, just where the band ends. If you find with those knee-high socks the fabric's too thin and you're swelling a little bit into them, but you find that they're helpful, slightly thicker or more knit fabric, kind of bring this a little closer so you can see the ridges. It kind of looks like a dress sock. May be more helpful. I find that this is what helps me when I'm flying, as I do get swelling in my legs, ankles, and feet when I fly. So I wear a flat knit compression sock instead of one that's more stretchy or elastic. So the inelastic ones or less stretchy compression socks provide more pressure against your skin, help you swell less into them. So if you find the knee-high sock doesn't help you and you do have swelling above that or into the knee or even into the thigh, then a thigh-high compression stocking might be the next thing to look for. So those are going to look like these. I promise they stretch quite a bit. So even if you feel like you get it out of the box and you're like, hey, this isn't going to be long enough for my leg, it probably will be. The nice part about thigh-high socks or stockings that you may not have known is that they can come with what's called a silicone border. And so these are raised silicone dots, medical grade. They help stick to your skin, so it kind of acts like a garter without the garter to keep your compression stockings up so that they're not falling down. So thigh-high stockings are great if you have knee, thigh swelling, obviously also if you have calf or ankle swelling. I find that I'm more comfortable in a thigh-high than I am in a knee-high because of where the compression sock ends. I really just like coverage, including my knee. I also prefer thigh highs to pantyhose, as these are easier to use when you're in the restroom. You don't have to kind of shimmy, wiggle, and kind of get stuck in pantyhose, especially when flying, or in tight quarters in bathrooms. The thigh highs, I tend to just fold down a little bit, use the restroom as normal, put them back up, and good to go. And these should hook kind of right above the inner thigh, kind of where your tissue might normally jut out, and really go right up close to the underwear and end right below your buttock. So right where the cheek would end, this is where these should end, so that when you sit down, they don't fold over. If you are looking for pantyhose, they exist in their full glory. Like I said, I'm not as big a fan if you don't need compression to go above your thigh, because they're just more fun to get in and out of, as they have extra compression all the way through. They're even more difficult to get on and off than regular hosiery for ladies. But they exist, and there are different options. Mostly the compression ends right at the thigh, so you can see there's this kind of fabric change. The compression on these ends right at the thigh, so there isn't a lot into the waist component, but when you fold them down to take them off to go to the bathroom, it kind of adds extra compression around the thighs and makes it a little harder to use the bathroom. And so for people with back pain who find they need to have their knees a little bit wider apart when they're sitting, pulling down compression stockings can make that a little more difficult. So how do you figure out what's the right compression sock for you, or the right fit? It should fit smoothly. You shouldn't notice that your tissues are kind of folding over the top of it. When you're measuring yourself, you should find that you, above your ankle, around your knee, and around your thigh, fall in the middle of the range of the sizes that are offered in terms of centimeters or inches. That you shouldn't be too close to the top, that's going to be a little bit too tight, or too close to the bottom of the range, that'll be too loose and may fall down. If you find you're falling in between sizes, you may even need custom compression stockings or socks. And so that's something where a local surgical supply store could help you with. You may even have coverage for that through insurance. That's something to explore, or get a prescription from your physician. And that's something the surgical supply store should be able to help you figure out. If you do have prolonged swelling after your knee replacement, even checking in with someone who's called a lymphedema therapist could be helpful to help you manage that and determine the right compression for you. So that's everything. Let me know if you guys have questions. Otherwise, I'm gonna hop off here and head home for the day. But I'll check back in if there are questions and answer them as best I can, without giving away too much information that's really specific to you guys. But I can give some resources on different brands that I like, and or how to measure yourself as well. Bye.